So the title of the presentation today is Getting Out of a Cult, Therapeutic Wandering and Specific Limits. And I already have a good news for you. I will finish in about half an hour, so you will have some time before the next session. Okay, so I'm the first author cited here. My name is Elena Vlad. I'm a psychiatrist. I'm based in France. And I work in a totally different domain than this. I'm working in clinical research. So this is all kind of voluntary work as part of an activity I have to support cult victims with the Anti-Cult Association in France, which is called GMP. The other two authors are Sarah Martinez, here in the room with me to sustain me, and Nicolas Sadus, a colleague from France, psychologist, who helped us with the study. And actually, the story here is that, like most of us here, at a certain point of my life, I get hooked in a cult for not so long time, but enough for me to realize that that's a big problem and a misunderstanding in our society around this phenomenon. And I've been following up a very close friend that after he was in the cult for like 10 years, between 20 and 30 years old, he tried to heal himself. Welcome. So he went through different psychotherapies, psychiatrists, and actually nobody was able to understand what was happening to him. They were treating him for depression, they were treating him for anxiety. But when I told him, but did you tell them that you were out of a cult? And he said, yes, I did. And they didn't hear that. So I realized that it's a big problem, that psychologists, medical doctors are not real aware of the phenomenon. And I prepared, with the help of my colleagues, this study, which I communicated to the French Congress of Psychiatry last year, just for awareness of the medical colleagues on the phenomenon. So as you know, the cult victims, they really speak little about their history because of shame, fear, or lack of trust that they could not be understood. So I heard today communication around this. However, in many situations, they do speak about their current history and they are not heard. In France, but I think it's the same around the world, unfortunately, there is no formal education for medical doctors, psychiatrists, and very little training opportunities for psychologists on this topic. And the cold exit state is very poorly understood by most mental health professionals, and I said, and the victims, they don't get treated for what they really have, but only for symptomatic. Okay. So from our own practice, as I said, I'm offering support once per week to cult victims. So I'm answering the phone of permanence, psychological permanence, a couple of hours per week. So I'm getting some experience. So they tend to consult multiple therapists without obtaining relief from their symptoms. Some fear psychiatrists and psychologists, and this may be related with what the cult taught them, that this type of therapists are dangerous, and they may be particularly attracted to unconventional therapies using magic or pseudoscientific methods. What are the questions that we asked ourselves and we try to answer via this study? So were there psychological difficulties before the cult entry? So just to summarize, we interviewed 30 cult exit persons. So these are the questions. Were there psychological difficulties before the cult? What were their main symptoms after the cult exit? Did they look for help? And how was their therapeutic journey? And was their cult exit situation taken into account by the therapists? We already know that most of them not, but let's see what the study says. And was the relief obtained? And if yes, was there a link between the efficacy of the therapy and the fact that their cult exit situation was taken into account. Fair enough. So what we said, we created on Google Forms 19 questionnaire that was sent via cult victim groups on social media. We had 30 persons who completed the questionnaire. 14 were from France and 16 from Spanish-speaking countries, so not only Spanish, also from South America. The participants were all informed about the aim of the study and the fact that by completing the questionnaire, they agreed with this data use. We did not collect personal data like name, date of birth, etc. And they could contact us to ask questions, whatever questions they have. I made a step aside here to speak about Dieter Roman's three-step model. So we are here at the ICSA conference, which has the title Evidence-Based Practices in Cult Recovery. And after a lot of literature search, it was really very difficult for us to have some evidence-based proof of any type of method that can work for cult exit. But we stopped at this three-step model that made sense to us. This is a short individualized therapy, like 5 to 10 sessions for cult victims. And in step 1, there is a search for relevant information, so like what is called psychological education, about cult ideology, values, world vision, methods used, sanctions in case of deviant behavior, prophecies with personal consequences in case of exit. So it means that the therapist will look into what the cult is. This first step. Second is the psychoeducation on mind control techniques used by this particular cult on impact of beliefs, ideology, as well as phenomena like cognitive dissonance, obedience to authority, self-fulfilling prophecy, etc. During this step 2, usually a painful awareness may happen. And the step 3 is analysis of motives and predisposing factors to enter the cult. Why? It was not possible to say no or simply leave early. So we took into the account this model when we defined appropriate taken into account of cult situation. So I will explain this better later, but I wanted to make you aware what model we took into consideration in our study. So these are the results, and the fact that I present the French group and the Spanish group is simply for practical reasons that we got them in the 2 languages, so in 2 different sets. Right? It's not to compare France and Spanish-speaking countries. So about the time, this is the description of the sample. So time inside the cult, 2 to 28 years. For French group, many of them were more than one cult. And Spanish-speaking group, few weeks to 30 years. And the time since exit, 1 to 28 years in one group and to 37 years in the other group. And the type of cult, I will not read them to you, but they are very diverse. About psychological symptoms at study entry. So from the French group, so 14 people, we had 6 that had declared symptoms before cult entry for which they consulted, but without positive outcome. So they suffered before the cult entry with anxiety, depression, PTSD, burnout, anorexia. 3 said that did not present any symptoms, and 5 were born in cult, so the question doesn't make sense, right? And for the Spanish-speaking group, from 16 people, 4 of them had symptoms before the cult entry, only 1 consulted and without positive outcome for anxiety and depression, and 12 did not present symptoms according to them, what they declared. After the cult exit, total different situation. So from the French group, everybody, 14 out of 14, presented feelings of emptiness, purposeless, guilt, lack of self-esteem, loneliness, and social difficulties. 11 out of 14 fear of metaphysical punishments, 9 of 14 nightmares, reminiscence, and half of them addictions. And for the Spanish-speaking group, most of them loneliness, social difficulties, emptiness, purposeless, guilt, as you can see, and 3 out of 16 addictions. So we see a big difference between psychological symptoms before entry and after. Did they look for psychological help? So for the French group, 3 did not look, despite the presence of invalidating symptoms, for the reasons I was referring to at the beginning of the presentation. But 8 from 11 who did look for help consulted 4 to 9 professionals for each of them. So the therapeutic wandering term comes from here. From the Spanish-speaking group, 2 did not seek for help, and 3 from 14 who did look for help consulted 4 to 6 professionals each. Was the help provided adequate? So here comes the 3-step model, saying that from 11 persons from the French group who did seek for help, 5 received from at least 1 specialist. So some had to go to 9 specialists to find someone who was right, who provided adequate therapy. So 4 of them received the type 3-step model. So they found a therapist that was interested in what the code was. They provided psychoeducational therapy, and they studied the reasons for code entry, why I did not say no, etc. What I described, the 3-step model. And one that we considered also adequate therapy, it was targeted for dissociative identity disorder. And for the Spanish-speaking group, half of them received adequate therapy type 3-step. So you see, it's not really that nobody received, right? Many of them went until they found someone, but sometimes it took years and many specialists to go through to find the right person. About perceived efficacy in relationship with type of support, actually there is no surprise here. From the ones who received adequate therapy, they all considered it as efficacious, even life-saving. And for the ones who did not receive adequate therapy as defined for the study, most of them said that this therapy was really useless, that they lost their time. In some cases, they were quite happy, but probably the way we defined the right therapy is not perfect here. So this would fit. Mm-hmm. So from the Spanish-speaking group, from the 7 persons who received adequate, 6 considered it very helpful, and 1 gave an ambiguous answer. And from the ones who did not receive adequate support, 4 said it was useless, 2 said it was quite helpful, and 1 gave a ambiguous answer. So that's the summary for the full group, so 30 ex-adepts. So 10 from 30 had symptoms before cold entry, and all 30 had significant psychological symptoms after the exit. From 30, 25 looked for psychological support, psychiatrists or psychologists after the exit, and most of them consulted more than 1 therapist, up to 9. From the 12 who received adequate support, as defined for the purpose of the study, 11 considered it very helpful, 1 provided ambiguous answer. So I would say that this result would be kind of evidence-based for the 3-step model that it does work, right? And from the 13 who received inadequate psychotherapy, 10 considered it as unuseful, 2 were happy, and 1 gave ambiguous answer. So these are the questions we asked at the beginning of the study. Was there a psychological fragility before the cold entry? So 1/3 of the persons we interviewed mentioned that they were suffering before the cold entry. Some were going through some life difficulties, familial, professional, but more than half were actually doing well and were rather in a spiritual quest. Is there any correlation with symptoms before the colds with exit symptoms and search for therapy? So all had post-cold symptoms, right? And lack of symptoms before the cold did not correlate with less symptoms after. And 6 participants did not seek for help at all, despite the presence of invalidating symptoms. For those who did look for help, most of them moved from a therapist from 4 to 9. So again, this therapeutic wandering that we are trying to strengthen here. Were the study participants able to find adequate psychological support? So from 25 ex-adepts who looked for psychological support, 11, so less than half, received 3-step type therapy and 1 specific dissociative identity disorder psychotherapy. And 13 did not receive adequate therapy despite consulting multiple mental health professionals. And last but not least, the correlation between the therapy adequacy and efficacy evaluated by the ex-adepts. From 12 study participants who received adequate therapy, 11 considered it a very helpful, life-saving. And from 13 who received different type of psychological support, 9 evaluated it as useless, 3 considered the help provided as useful, 1 answer was omitted. So there is a very high correlation between the psychological support adequacy as defined for the purpose of this study and its efficacy evaluated by the study participants. And these results actually support the importance of including in psychiatrists and psychologists basic formation a training on cult exit victim-specific needs like type 3-step model or other models that may prove useful. We found this one, we use this one in our study because it makes sense. It doesn't mean that there are no others. But this one was really like focused therapy, short-term, and looks like it works. The study limitation. So the participants learned about this study via article, social media groups. So these are not these 30 who responded to our research are not representative for all the cult exit members. These are persons that already looked for help, that already tried to understand, that are kind of militant and very present on social media on this. So it's not the situation for most of the exit cult members, okay? But as you know, the others are really difficult to find for research. The psychological evaluation for symptom before cult entry and after was on evaluation. So it was not that it was a psychological test done before or after. We just asked them how they were. So we base our research results on this, okay? For the purpose of the study, we've identified as adequate therapy the approaches that meet the 3-step model requirements, as well as the dissociative identity disorder directed psychotherapy. But we are aware that there may be other effective therapies for cult victims. So there are no financial conflict of interest. We are all volunteers for support of cult victims. And thank you for listening, and let me know if you have any questions. Really quick, 20 minutes. Yes, please.